and then start talking.
Hello, I'm very sorry about the delay. We had some technical issues. I hope you can see me now. It took us a few minutes to get everything sorted out with the video. Thank you for your patience. My name is Bala Ambati. I'm here with Pacific Clear Vision Institute in Eugene, Oregon. Today I wanted to chat with you a little bit about LASIK and laser vision restoration options. I know everyone's probably stressed right now with the coronavirus epidemic and staying home, and I wanted to let you know that we still remain committed to vision care and answering any questions you might have. So let's get into it. LASIK and laser vision restoration options basically work on the front of the eye, the cornea, and I have a little model with me here. The eye is very much like an old camera where light enters the front of the eye, which is the cornea, and then it gets focused on the retina, which is the back part of the eye. And the front of the eye, the cornea, actually has 2/3 of the focusing power of the whole eye. So it's very important. In addition to being a window, it helps focus light. And you'll notice that the cornea is shaped like this dome or a sphere. And in terms of any particular patient's prescription or how much glasses or contact lens power they need, the shape of the cornea interacts with the length of the eye to determine whether light is focused properly or not. The cornea is about 0.5 millimeter in thickness, and to help properly see, light enters it, goes through the lens, and then reaches the fovea right in the center of the retina at the back. Now, in somebody with a nearsightedness, if they're very nearsighted, such as myself, that's called myopia. And what that means for an individual patient is that if I take my glasses off, I can only see about here. Beyond that, it gets blurry. And nearsightedness affects about 1/3 of the population in America, and it's growing. More and more children and young people are becoming nearsighted just with a lot of reading and near work and computer work and not enough outdoor time. So what we can do for nearsightedness is to change the shape of the cornea. And the way we do that is using laser technology, where we use a laser to lift 1/5 of the thickness of the cornea. So we just lift up a thin layer of the surface of the cornea and lay that off to the side. And then we use a reshaping laser to remove the nearsightedness and any astigmatism. Astigmatism is when the cornea is shaped more like a football than a sphere, and by correcting it, we're changing the shape of the cornea to make it more round. So by removing nearsightedness and astigmatism, we can correct vision so that someone can see 20/20 at distance. Now when we do this, generally LASIK works, or laser vision correction works very well from age 18 to 45. Once you start getting into the upper 40s and 50s, people start having trouble reading. And that's just a natural function of increasing wisdom and maturity. To deal with that is a bit more challenging. And that is because it's the lens in the eye that loses power with time. So if someone's over 50 or 55, generally I don't recommend LASIK. I recommend working on the lens. But if someone's in their upper teens or 20s or 30s or early 40s, LASIK can be a great option to get great distance vision knowing that when you get to age 45 or your upper 40s, you will need reading glasses. If someone had never had LASIK and was nearsighted to begin with, then you would need bifocals when you get to your upper 40s. If somebody is very farsighted to begin with, if they're a +2 or +3, we can also use LASIK to treat farsightedness, but there's a much fewer number of those patients than there are nearsighted patients. What's involved in laser vision correction? So we bring you in on a certain day, we numb your eye, we put an eyelid opener to keep the eye open, then you'll lay on a bed and look at a flashing green light. And the laser will first make the flap and then do the reshaping. All of it should take about 10 to 12 minutes per eye, so about 25 minutes total. The day of the procedure, we'd like you to go home and relax and rest. After the procedure, you should not watch any TV or use the phone or use the computer. We really want you to keep your eyes closed as much as possible on the day of the procedure when you go home, so that nothing gets into your eye. The day after the procedure, generally you can do most things normally. Most people can drive the day after the procedure. It's a very fast recovery. Vision keeps getting better day by day for the first week or so after surgery. But most people can drive within the first 24 hours and can go back to work the day after. It is important not to rub the eye for the first 2 or 3 days. It's important not to let water get into the eye for the first 24 hours, so no swimming for the first day or two after the surgery. Risks of any surgery are bleeding and infection. Those risks are very low, and we do our very best to prevent them, but they're never zero. But they're much less than 1 in 10,000. Those are very rare issues. It is common to have some dryness after laser vision correction for the first couple of months. You might need some artificial tears. It is common to need some sunglasses for the first few days after the procedure. Generally, within about a month after the procedure, you should be feeling pretty close to normal. Some people do see some rings around lights for the first 4 to 6 weeks. If you see those rings around lights, we can give some eye drops. That's just a function of the healing of the edge of the flap. And if those rings are bothersome, we can treat that with some eye drops. But again, they fade within 4 to 6 weeks. Some patients are not candidates for LASIK because their cornea might be too thin. And in that case, we can consider something called PRK. Unfortunately, for somebody like me, my corneas are both too thin and my prescription is very high, so I'm not a candidate for either PRK or LASIK. PRK is where we just do a laser from the surface without making a flap. That can be useful in patients who are less than a -6 and have a thin cornea. But there are certain situations, such as myself, where if the corneal thickness is too low and the prescription is very high, that one is not a candidate for LASIK. And so we take the time in the pre-op appointment. It usually takes about an hour and a half to do the evaluation, and we take that time to see whether you are a good candidate for the procedure. And if not, we can go through the different options. We also look and see if you have any other eye conditions that can affect your vision and your eye health and the outcome of the procedure. The effect of LASIK should be long-term. Again, the distance correction should be good for the long-term. The reading will get worse, usually in the mid-40s, just with increasing wisdom and maturity. And then LASIK doesn't affect the health of the rest of the eye. So if you're destined to get macular degeneration when you're 80, you'll still get that. If you're destined to get cataracts when you're 60, that will still happen. And you should still get your regular eye exams for glaucoma or diabetes and dry eye and things like that. In terms of eye drops, in general, you'll need some eye drops to heal from the procedure 4 times a day for about 5 days after the LASIK. You'll need some artificial tears for a few weeks, but beyond that it should be pretty straightforward. LASIK can be done in all kinds of occupations. I've done patients who are pilots and football players and basketball players. None of those are restrictions. People who have joined the military, people who are firefighters, anyone who really wants to not need to wear glasses or contacts for whatever personal or occupational reason could be a good candidate for LASIK. We would need to do the evaluation and check your eye, the corneal thickness and the shape, and if you're a good candidate, then we'd be happy to take care of you. So with that, let me pause. If you have any questions, there should be a comment box on the side of your screen, and feel free to ask any questions. So if there's no questions, then feel free to email me later. My email is bambati@gmail.com. Oh, we have a question here. So the question is, for patients who currently have dry eyes, can the severity of dry eyes preclude them from getting LASIK? So that's a great question. Dry eye is very common. I think affects about 20 million Americans, so about 1 out of every 12 or 15 Americans has some dry eye. And dry eye should be treated before the procedure. And the reason for that is treating the dry eye helps the eye comfort and helps the recovery after the procedure. So there are some patients with certain diseases who have very severe dry eye, like lupus or rheumatoid arthritis, and they have other medical problems that would preclude or prevent them from being a candidate for LASIK. But the vast majority of dry eye patients can be treated before surgery and achieve a very nice result. So causes of dry eye that are the most common causes include looking at the computer too long. You know, a lot of modern workers are stuck at their computer all day and they forget to blink. Other causes of dry eye include certain medications, blood pressure medications, for example, or antihistamines can cause dry eye. Certain antidepressants can cause dry eye as well. So all of those we consider before the surgery and see if the medications can be adjusted, or if we can do dry eye therapy, which can include not just artificial tears, but also warm compresses, fish oil, putting in tear duct plugs in the lower lids. We all have a little hole in the lower eyelid where the tears drain from the eye to the nose, and that's why when you cry you sniffle. And by putting a plug in the tear duct, that keeps the tears in your eye longer, and that helps with dry eye. Contact lenses are another cause of dry eye, and you know, a lot of people wear contact lenses all day or sometimes sleep in them. And when that happens, contact lenses can damage the tear-producing glands of the eye. So just getting out of contact lenses for a brief period of time can help with dry eye and ocular or eye surface comfort. So there's a lot of different things we would look at in the consultation, looking at seeing if there's inflammation of the surface of the eye, if there's any loss of tear glands, if there's any issues with the eyelashes, and all of those things we try to address before surgery and get the eye as best as we can before doing LASIK. So in general, for the vast majority of people who are interested in LASIK and have dry eye, if we treat the dry eye properly before the procedure, they'll generally have a great result with LASIK, and there's no need to preclude the surgery. So I hope that answers your question. But yeah, that's a great thing to bring up. Are there any other questions from the audience? Well, terrific. I've enjoyed being with you today. Again, my email is bambati@gmail.com, and feel free to follow up with me if you have any questions. Our practice website is www.pcvi.com, Pacific Clear Vision Institute, pcvi.com, and so you can watch some more videos on LASIK at the website. And um, uh, feel free to reach out to us if you have any questions about LASIK or other laser vision restoration options or any other eye problems. Please do stay safe and stay sane out there. I know it's a stressful time, but hopefully things will improve with the epidemic in a few weeks, and we can start putting our lives back together. So stay close to your families, take care of yourselves, get good sleep, exercise, wash your hands, maintain social distancing, and we hope to see you in the office soon. Have a great day, and we will post this video on our Facebook page, and so you can share that with your family and friends, anybody who's interested in laser vision restoration or laser correction. Thank you so much, and appreciate your attention. Have a wonderful day, and take care.